The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Laura Bingell, the Open Doors Transition Center nurse. And our webinar today is Organs of the Body and Things That Go Wrong. During the webinar, you will be able to type in questions, and please feel free to type them in as we go along or use the raise your hand method. And we will unmute you temporarily and you'll be able to ask your question. So I'm hoping that you enjoy this broadcast as much as I've enjoyed putting it together. Understanding how major organs of the human body function is important, first in maintaining health, but also for making connection when things don't work quite right. When one organ malfunctions, it affects the others. So building our knowledge of basic anatomy and physiology can improve our ability to anticipate what might be needed by an individual who's developed one or more chronic health issues. This better equips us to help participants in planning for the needs that they may not be anticipating and to improve our own health. So in this slide, anatomy and physiology, the definition of anatomy is the study of the structure of body parts. The what and the where, what it's made, what is it made of and where is it located. And then physiology is a study of the functions, which are the relationships to the other body parts, how they work together and why. What is their purpose? Next slide. There we go. The human body has over 75 organs, and I say 75, but the exact number will depend on really who you ask. But it's close to there, 75, 78, 79. The definition of an organ is a group of two or more tissues that perform a specific function or functions. And today we'll focus on this list and proceed from head to toe. We're going to start with primary functions, then relationships with other organs, and then we'll speak about some of the common disorders, and I know you've seen these in your work as transition specialists. So as I said, you may want to ask questions as we go, and that's going to be just fine. So starting with the skin. It is the largest organ of the human body. For an adult, the average size is 22 square feet of surface area. If you want to focus in your mind to get an idea, that's about half of a ping pong table and about 9 pounds. So think of a bowling ball. And the main functions of the skin are regulating body temperature, protecting from outside invasion, protecting from harmful effects of radiation, preventing loss of essential body fluids, filtering toxins, and mechanical support. And considering point number 1, heat exposure causes blood vessels near the skin surface to dilate, allowing large amounts of blood to circulate near the surface where the heat can be released. And also sweating can help to evaporate heat. Exposure to cold makes the blood vessels constrict to retain heat. And shivering raises the body temperature by activity and by causing hair shafts to stand up. This holds air close to the skin surface, allowing it to warm from the body heat, like a bird when it fluffs its feathers. On point number 3, pigment in the skin scatters ultraviolet rays. Of interest, people with light skin are approximately 70 times more likely to develop skin cancer than people with dark skin, because light-skinned people have less of this protective pigment called melanin. And on point number 5, a deeper layer of skin has lymph vessels that carry away toxins or bacteria, and also sweat glands and pores that play a vital role in this. Next slide. Because of everything that the skin does, there are many issues that can show up. Allergies can manifest in the skin from direct exposure to an allergen, like poison ivy, or from ingestion, like peanut butter, or from inhalation, like pollen. Developing a rash is part of the inflammatory response. Chemicals are produced in nearby connective tissues to help move white blood cells to the affected area, to fight off intruders. And it also helps to eliminate the initial cause of injury, clear out dead cells at the site, and to start any needed repairs. So thinking through a skin issue, let's say someone spills hot water from a stove down the front of them, causing very severe burns on their legs. What other organs could be affected by the burns on the skin? Does anyone have any ideas? I'll just give you a brief opportunity to type in the answer. Okay, so I'll move on then. So think again that keeping fluids in the body is part of what the skin does. So with a burn, they'll lose fluids. This can cause dehydration. This will drop the blood pressure. And then you can think that the heart and the kidneys and all of these things are going to be affected by this loss of fluid. Or because of the drop in blood pressure, there won't be as much oxygen going to the brain. So you can see how one organ will affect a bunch of the other ones as well. So if a person already has a heart, kidney, or lung condition, I'm sure you can see that there would be an additional impact. Or someone with diabetes, a greater risk for infection. And someone with memory problems now getting even less oxygen to their brains. So again, as I said, you can see the impact. Please, next slide. This is a classic shingles rash. After a person has had chickenpox, the virus lies dormant in the central nervous system. Years later, it can reactivate as shingles when the person's immunity is low for whatever reason. It then shows up on the skin by following a nerve pathway. That's what creates this characteristic one-side pattern like shown on the slide. It is very painful and frequently confused with other types of pain, even heart pain or kidney pain, because the nerve pain comes before the rash is visible. If recognized early, there are antiviral medications that can shorten its course and reduce its severity. It is contagious. Physical contact between people with shingles and anyone who hasn't had chickenpox or the vaccine can cause chickenpox. A lot of people confuse this. So contact with people with poor immune systems, pregnant women, and newborns should be avoided until any blisters scab over. Complications include infections as a result of the skin being impaired and nerve pain that can continue after the infection is resolved. This is called post-herpetic nerve pain, and it can even cause vision loss if the affected nerve was a nerve that serves an eye. Moving on to the brain, it is the command center of the body, and nothing happens without it. It can work consciously and unconsciously, and each area has its own particular assignments. A mature brain weighs about 3 pounds and is about the size of a cantaloupe. In that small area are at least 100 trillion neural connections. That is 1 plus 14 zeros. And according to some sources, add an additional 0, so somewhere between 14 and 15 zeros. To compare, the Milky Way galaxy has, by some estimates, 100 to 400 billion stars. That's 11 zeros. So it's pretty phenomenal. Memory capacity can range up to, in computer language, 1,000 terabytes of data. To compare this, the US Library of Congress has a total of, now I've got to make sure I get these numbers right, 168,291,624 items in its collections, and this represents about 10 terabytes of data. So think of the Milky Way galaxy and cram 100 of them into the space of your head, and that will give you an idea. Okay, next slide. Technologically, at this point, we're not able to actually see this tiny neural connection in the brain, but here is a representation of one, and it represents the transfer of chemicals across that minuscule gap to spark that reaction, maybe a muscle reaction. So this could be the reaction chain that would cause a blink of an eye, something that is happening and we're not even thinking about. As we've discussed in past webinars, both with stroke and other TBIs, any function can be affected by a brain injury. It depends on the area of the brain that is damaged. Chronic traumatic encephalopathy, or CTE, is caused by repeated blows to the head, and it's a big problem in sports like football and boxing. Shaken baby syndrome, or the AHT, is abusive head trauma. You may see it listed as that sometimes. There are about 1,300 reported cases in the United States every year, and 25% die from the initial trauma. 80% of survivors will have lifelong disabilities, and it's usually in areas like speech, learning, hearing, and vision. If we jump to the older population, this is a good opportunity to differentiate dementia from senility. Dementia can be related to many conditions, basically anything that impairs the brain's ability to get oxygen and nutrients or conduct impulses, like substance abuse, heart disease, poor lung function, hardening of the arteries, MS, cancer, or diseases that specifically affect the brain like Alzheimer's, Huntington's, and Parkinson's. Senility means relating to or characteristic of old age. Because many health authorities argue that losing cognitive function is not a normal part of aging, the literal definitions have blurred and the two words are often used interchangeably. Senile dementia isn't redundant. It's actually this arguable condition of age-related loss of cognitive function. Seizures occur because of abnormal impulses, if we move on to epilepsy, and electrical conduction in the brain. They can be related to other conditions like a stroke or head trauma and can range from almost unnoticeable to violent, uncontrolled spasming. And there are specific criteria for someone to be diagnosed with epilepsy. Okay, so now here's the comparison, just a snapshot of the activity between two brains, a normal and someone with Alzheimer's disease. And this is done on a PET scan, which measures the metabolic activity. So you can see significant difference between the amount of activity going on in a normal brain compared to someone with Alzheimer's. So now the lungs. Adult set of lungs is about 3 pounds together. And the right lung is bigger with 3 lobes than the left, which has only 2. And this allows for room for the heart on the left side of the chest. The average maximum adult volume in the lungs is about 5 liters of air. Typically, a person will inhale about 1/2 liter of air in a normal relaxed breath, and a little over 2 liters will remain in the lungs after exhalation. The lungs can collapse if too much air is forced out, and this can happen from a blow like a car accident, and sometimes even just from very forceful coughing, it can happen. You can visualize soda bottles for an idea of the amount of volume in each lung. And the functions of the lung are pulling oxygen from inhaled air to distribute to the body and expelling waste in the form of carbon dioxide. People can survive with portions of their lungs gone. A lobectomy, if you see this on a report, is a single lobe having had been removed, and a pneumonectomy can be up to an entire lung having been removed. This does significantly alter a person's ability to tolerate activity, but given the alternatives, this can be done. Next slide. Cancer is probably the most common cause of having to remove an entire lung or lobe so that an isolated tumor can be removed to cure the cancer. Chronic obstructive pulmonary disease is actually a group of lung diseases, and it includes emphysema and chronic bronchitis that block and diminish airflow in the lungs. COPD is the leading cause of death and illness worldwide. Long-term cigarette smoking is the primary culprit for this. Many of the symptoms are similar to asthma. Asthma, however, particularly affects the airways to the lungs, and they react to trigger to a trigger and spasm becoming constricted. So triggers can be a variety of things like dust, pet dander, perfume, or even exercise. And about 15% of people with asthma also have the chronic obstructive pulmonary disease, but not necessarily. Pulmonary embolism is a clot in the lungs. It is often associated with blood clots in the lower legs. These tend to form when the heartbeat is irregular or when blood pools in the lower legs from poor circulation. This is why it's so important not to let blood stagnate on long trips, but to take frequent breaks to stand and walk and move around. And the same mechanism is for other blood clots, like that form in a heart attack or in a stroke. With pulmonary hypertension, the arteries become too narrow to handle the amount of blood that must be pumped through the lungs, and this causes several things to happen. The blood backs up in the veins, returning blood to the heart. Pressure increases in the right side of the heart, so the heart has to work harder to push the blood through the lungs, and this strains the muscle of the heart. If this is left untreated, the right side of the heart weakens and can fail. Because the blood has difficulty getting through the lungs, overall oxygen levels drop. This puts a strain on any other organ that isn't getting enough oxygen. Okay, next. Very little commentary is needed here. We will say that the healthy lungs are on the left-hand side, and lungs that were subjected to smoking are on the right. Functions of the heart. The heart has 4 distinct sections called chambers, 4 valves between chambers, and many of its own blood vessels. It is the size of a human fist. The lungs are basically positioned around the heart, so the right side pumps to the lungs to get oxygen, and it doesn't need to pump as forcefully as the left side does to pump the oxygenated blood from the lungs to the far reaches of the body. So the left side of the heart is stronger. The pumping action of the heart is regulated by electrical impulses that originate in the upper right portion of the heart, triggering ordered contractions in the rest of the heart to direct the blood out to the body. These electrical impulses are what you see on an EKG strip. The lub-dub sound is the opening and closing of the valves of the heart to hold and to move the blood efficiently through the chambers of the heart. So if you use an average of 80 beats per minute, a heart beats about 4,800 times an hour, 115,200 times a day, and 42,048,000 times a year. If you live to be 80 years old, that's around 3.5 billion heartbeats. We've already talked a little bit about blood clots. And blood has the ability to clot for a very good reason. We know that if we're injured, it needs to. It's designed to clot when it's still and not in motion. So when the heart is ineffectively pumping, like with an arrhythmia, I have listed atrial fib. It's the most common for blood clots, or with a leaky heart valve, which you may have heard called a murmur. Clots form because the blood is not moving as it should. The clots that form can then lodge in smaller blood vessels, and this is the cause of pulmonary embolism, DVT or deep vein thrombosis, heart attack, and stroke. Although stroke can be caused by other things as well, but a clot can cause a stroke. This is also why people with certain arrhythmias are on blood thinners. It prolongs the time it takes for the blood to clot. With coronary artery disease, plaque first grows within the walls of the artery, supplying the heart itself. This narrowing decreases the blood flow, sometimes enough to block it, or a sudden breakaway of plaque can create a blockage. This is why high blood pressure can be dangerous to someone with high cholesterol. The increased pressure will blow out pieces of the plaque, which will float through the vessels in the blood until they come to an area that is too narrow to pass through, and then it forms a blockage. And the risk factors of this are heart disease, family history, diabetes, uncontrolled high blood pressure, smoking, and obesity. Stenosis or narrowing can be caused by uncontrolled hypertension, some autoimmune diseases, and certain childhood infections. A murmur, which is really a leaky valve, occurs most often in the aortic or mitral valves, and treatment depends on how weak the valve is and which valve it is. And it can range from anything from watch and wait to surgery, depending on how bad it is or which valve is affected. When the heart muscle is weakened and enlarged, as in congestive heart failure, it doesn't pump the blood through the body well. Blood and other fluids back up, and the heart becomes congested. The breathing becomes wet, and the legs swell with extra fluid that's not being pumped through. And I'll ask if anyone would like to hazard a guess what other organs might be affected by this.
There is a question, Laura. Geraldine would like to know, does gum disease cause heart disease?
Gum disease?
Yes.
Okay, that is a very good question. Diseases of the teeth can be associated with heart valve disease. It's one reason why really good dental care is important to people, particularly if a person gets like a strep infection in there. That's also why some of the childhood diseases can cause valve murmurs later in life as well, because the strep infections tend to be attracted to the valves in the heart. So when I actually took care of a very young man in his 20s when I did home care, who had a very severe endocarditis. He had a very severe heart infection, and it was caused by the fact that he had rotten teeth. And it was because the strep infection went on so long that it actually took up residence in his heart, and he had to be on IV antibiotics at home for an extended period of time. So that's the link that there is between those. For gum disease, I would say not really, but if you have gum disease, then someone does really need to take those extra precautions to really do good dental hygiene to protect their heart and their other organs. Okay. So as I had said, what other things could this affect as far as if the heart isn't functioning? I just want to highlight the fact that when the heart doesn't function and the blood pools in the legs and people get swelling, because I think this is something you'll see as transition specialists, that what they call peripheral edema. It'll really affect how well their tissues can heal, and it predisposes them to infections in their legs. So you want to watch that on your participants that have congestive heart failure, that they're doing what they're supposed to with taking their fluid medicines and elevating their legs to try to keep that fluid pulling to a minimum. Okay, we can go to the next. And this is a normal heart as compared to one that is enlarged, like with congestive heart failure, or the LVH means left ventricular hypertrophy. This is really very often seen in kidney disease as well. And the thing is here is that just because it's larger doesn't mean it's working better. It's working less efficiently because the muscle is weaker. And when you look closely, you'll see that the open part of the chamber is smaller than in the normal heart, so it doesn't push as much blood out, and then the pumping is also weaker, so it's getting less blood and not doing it as well when it's enlarged like that. Okay, next. The liver. It's the second largest single organ in the body after the skin, weighing about 4.5 pounds in the average adult, and the liver is made up of 2 lobes. The smaller lobe is generally the one used when someone donates for a transplant, and interestingly, it can regenerate. Underneath the liver is the gallbladder. You see the little green balloon-like thing there on the slide. It's an accessory, and it sits beneath to store bile made by the liver for breaking down fats. Gallstones, composed of cholesterol most of the time, can form and block the release of the bile, making digestion of fat a problem. And this is why greasy foods will trigger a gallbladder attack by causing the liver to produce more bile but preventing the gallbladder from releasing it. And also stones can sometimes move or migrate from the gallbladder itself and then block some of those ducts closer to the liver or the pancreas, and this requires emergency surgery when that happens. So next slide. So a few more issues of the liver, of course, are the hepatitis, and right now the big ones are A through E. And for hepatitis A and B, there are vaccines. We have covered the different differences in hepatitis in a previous webinar on infection control. Hepatitis C can be a short-term illness for some people, but somewhere around 75% of those who get it do become chronically infected. And up to 20% of those with chronic hep C will go on to develop cirrhosis over an extended period of time, and then a percentage of them will die from those complications. But there's no vaccine for hepatitis C, but there are treatments now. Many people with hep C don't know that they have it because they're not obviously sick, so it should be screened for by primary care physicians. Cirrhosis is a late stage of scarring of the liver, which can be caused by many diseases and habits, diseases such as hepatitis and habits such as alcohol abuse. And then more newly on the scene, related probably to the obesity epidemic in the United States, is non-alcoholic fatty liver disease. And it's estimated that it affects 10 to 20% of Americans, according to some experts right now. And it's new enough that there aren't any recommendations as far as reversal, but for prevention is, treating high blood pressure, treating obesity, and type 2 diabetes. So seem to be the biggest factors associated with it: obesity, diabetes, and high blood pressure. Okay, 2 livers, the healthy one and the not healthy one. Okay, we can go on. The stomach has cells that line it and cells that produce acid, up to 3 liters of acid every day. It starts the digestion of food with the mixture of the hydrochloric acid, mucus, and digestive enzymes. The acid has a pH of 1 to 2, which is only slightly less corrosive than battery acid. And cola is at about 2.5 in pH, to give you an idea. Food will stay in the stomach for 6 to 8 hours before moving to the small intestine. Next. GERD, or gastroesophageal reflux, is basically chronic heartburn that can be caused by many different things. It's treated with medicines initially to reduce production of acid. And these medicines are the proton pump inhibitors that you see, Protonix, Nexium, Prilosec. Some are over the counter, some are prescription. Interestingly, there's a new study, a German study from 2016, that is focusing on whether prolonged use of those proton pump inhibitors can lead to osteoporosis or even contribute to dementia in the elderly. So stay tuned on that one. But as far as managing GERD, it does reduce the production of acid and can prevent stomach ulcers. So ulcers, now that we're speaking about them, can form in the esophagus, stomach, or duodenum, the portion of the small intestine that you can see in the slide. And a person can have more than one at the same time. A peptic ulcer indicates the cause: acid, bacterial infection, like that H. pylori that is tested for before anyone has surgeries, and that can be treated with antibiotics. But also medications can prompt ulcers, like nonsteroidal anti-inflammatories. People who take Motrin or Aleve, naproxen for too long, and it irritates their stomachs. And then hiatal hernia, I want to just touch on that because I know you'll find a lot of people with these, and I want to be sure you know what they are. It occurs when the upper part of the stomach pushes upward through a weak diaphragm, the sheet-like muscle in the abdominal cavity that kind of holds everything in place there, and it shifts up toward the esophagus. It can be big or it can be small, and small ones will go unnoticed very often for quite a long time, and big ones will cause enough distress that they'll eventually require surgery to repair them. Now, after bariatric procedures, all or a portion of the work that the stomach does is altered, and this can result in vitamin and nutritional deficiencies. So you may see doctors prescribing vitamin B complexes, B1 and 12, folic acid, vitamin D, calcium, copper, zinc, selenium, and that's the reason why. It's because the stomach's not absorbing them anymore and they need to bolster them up somehow. For a peptic ulcer, if it perforates, it's a life-threatening emergency. Stomach acid can leak into the general abdominal cavity, and this, of course, is extremely painful and can come on suddenly, and a lot of times the pain will radiate from front to back. If an artery in the stomach itself is eroded by the acid or the ulcer itself, a person can hemorrhage and bleed to death very fast. So throwing up anything that looks like frank blood or coffee grounds or the passing of dark red liquid stools, people should go immediately to the hospital by ambulance and not waste any time. Blood, just for your information in case you come across it, blood in the GI tract is usually very, very foul smelling. And if you've smelled it once, you'll never forget it. So if you notice something that is like that, then call 911. Don't waste any time. Now, the pancreas. The pancreas is actually a gland, which means it's a collection of cells which are of the same type, making and releasing substances such as hormones or enzymes. Now remember, an organ, the definition was performing a function, but it didn't have to be the same type of cells. It could be different types of cells. So what I need to say here is a gland is always an organ. So the pancreas is a gland, but it's also an organ. But an organ is not always a gland. So very much like a square is a rectangle, but a rectangle isn't a square. There are two main types of glands, and the pancreas is special in this way because it's both. Exocrine, meaning secreting substances out into cavities or surfaces in the body, which the pancreas sends enzymes through a series of ducts out into the small intestine in order to digest food. And it's also endocrine, meaning inside the blood. And the islets of Langerhans release hormones, insulin, and glucagon into the bloodstream to control blood sugar levels. The pancreas itself is about 2.8 ounces, about the weight of a C battery, and is about 6 inches long. And you can see the positioning in the slide. Okay, next. So diabetes, which I know you're all very aware of because it's so common, is caused by malfunctioning of the insulin-producing cells in the pancreas. The two types of diabetes are discussed in more depth in a previous webinar, and we'll leave it at that because it needs an entire webinar. As always, there are multiple causing and contributing factors. When you see itis on the end of anything, it basically means inflammation. So inflammation or pancreatitis can cause damage to these cells, and it can be acute, which means severe and sudden in onset, or chronic, persistent and developing over a period of time. Blockages like gallstones can cause this by preventing digestive enzymes from leaving so that they start working while they're still in the pancreas, causing that inflammation. Other conditions that can cause this are excessive alcohol consumption, infection, physical trauma, tumor, medications, genetics, and some autoimmune diseases. Both acute and chronic pancreatitis can cause malnutrition by causing the pancreas to produce fewer enzymes for processing nutrients. And this will cause persistent diarrhea and weight loss, even though the person's diet hasn't changed. And even though they seem to be eating enough, the food is processed through the body without the nutrients being fully absorbed. So acute pancreatitis can lead to kidney failure from the buildup of toxins in the blood. And then kidney failure may require dialysis. And with pancreatitis, sometimes it's temporary, just till they overcome an injury, or permanent. And pancreatitis, if it's chronic, can be a predisposing factor to pancreatic cancer. So again, we can see how one organ will affect the others. In the next slide, we have our pictures of the normal pancreas and the one that's inflamed. So now to the kidneys. A single kidney weighs just over 5 ounces. It's a little bigger than a computer mouse. Most people have 2, but 1 can usually do the job. It filters wastes, toxins, and excess water from the blood. It helps the body maintain the correct pH balance and promotes bone strength by absorbing vitamin D, regulating blood pressure, and it's also instrumental in producing red blood cells. So they do a lot, and we often ignore them until they're not working. And like with diabetes, with kidney disease, there's a whole other webinar if you're interested in learning more about kidney disease. So, diabetes and high blood pressure put people at higher risk for developing kidney disease. Also, again, some autoimmune diseases can target the kidneys, like lupus. There's a condition called lupus nephritis. There's that itis for inflammation. And some of the symptoms, of course, would be fluid retention, blood in the urine. So let's think this again through. If the kidneys aren't filtering well and aren't getting rid of extra waste, toxins, and fluids, what other organs would this affect? Okay, so it would affect the heart, because the heart would have to pump extra fluid. It would affect the lungs, because the lung is working harder to oxygenate. And if the kidneys aren't producing red blood cells, people can become anemic. The skin, if the toxins aren't being filtered through the kidneys, the skin has more toxins to filter. And then the brain, again, if it's getting too many toxins and not enough oxygen, is not going to work optimally as well. So again, you can see the cascade effect of how one organ malfunctioning can just create chaos for all the others. Next slide. This is a picture of polycystic kidney disease. It's a genetic disorder associated with a group of different things. It can vary in severity, and people can live with it for some time before it actually starts to really bother them. But about 50% of people with this will develop kidney failure by the time they reach 60 years of age. And the picture should give you an idea of how a kidney with all of these cysts would not be able to do what it's supposed to do effectively. Moving along now to the small intestine. It's about 20 feet long, and the surface area is about 2,700 square feet. That's almost the area of a tennis court. 90% of nutrients are absorbed here. Only 10% takes place in the stomach and large intestine. So I want to speak a little bit about the issues now while you can still see the anatomy in the slide. If a person has a duodenal ulcer, it's the first portion of the small intestine, the duodenum there, closest to the stomach. And these are more common because they're closer to the acid production in the stomach. If a person has a J-tube feeding, and I have trouble pronouncing this one, J-junostomy, I think I did it right. it is inserted into the small intestine where the majority of the absorption occurs, or the jejunum, and you can see where that is. And if a person has an ileostomy for outgoing material, which they might with some of the diagnosis we'll list in the next slide, the lower section of the small intestine is surgically diverted to an opening in the abdominal wall, usually there on the lower right where it is. Okay, so we'll move to the next slide. Celiac disease is a serious genetic autoimmune disease triggered by an intolerance to gluten, a protein that's found in wheat, barley, and rye. The immune system mounts an attack on the finger-like villi of the small intestine. And we'll see that in a later slide. Crohn's disease can affect any portion of the GI tract, most commonly nearer to the outgoing end of the small intestine, which is why I've included it here, although it can affect the colon as well. It may be patchy or extended through the entire thickness of the bowel wall, and it can be aggravated by stress, impaired immune system, and smoking. Bleeding from an ulcer can be slow and go unnoticed, or it can cause life-threatening bleeding or perforation, as we've already talked about. But ulcers that bleed slowly might not produce symptoms until the person becomes anemic. Symptoms of anemia include fatigue, shortness of breath, especially with exertion, and pale skin color. These things can be seen. Back up just a minute there. I just want to hit one more thing. That with the anemia, I just want to give a caution, because fatigue being the prime symptom, sometime in older individuals, it's kind of hard to see this coming if it's slow. They may be anemic and feel fatigued, but they're thinking their fatigue is something entirely different. So this is another place we can help them advocate for themselves. In making sure that their primary care physician is, doing periodic blood work so that anemia would be picked up, because then they might be looking for these things as well, rather than saying, well, you're fatigued. That goes along with being old. We don't want to just let it go that way. Okay, next. Here's the picture I promised you of the healthy villi in the small intestine. And then those affected by celiac disease. You can see with the celiac disease, there's a lot less surface area, which is why the absorption is impaired. Okay. Now to the large intestine. This reabsorbs water that's used in digestion and eliminates undigested food and fiber. We won't go into specifics. It's just over 5 feet long, or roughly 50 square feet of surface area, about the same as that of a king-sized mattress. And there are no villi here, but there should be a village. The large intestine has a complex population of over 400 different bacterial species that is sparse in the stomach and upper intestine because of the acid level, but are happily present here in the lower bowel, and they should be. This community of friendly bacteria ferment carbohydrates not already digested to fully utilize the energy, and they also play a role in the synthesis of certain vitamins, vitamin B and vitamin K. If a colostomy is placed for elimination, it is here in the large intestine. It can be permanent or temporary and is usually placed on the lower left side of the abdomen. Okay. So some of the issues of the large intestine: polyps are common. They're very small, bulging pouches that form in the lining of the large intestine and are most frequently found in the lower part of the colon. They protrude inward into the bowel. This is not a picture of them here. Diverticula are what you see here. They are pouches that bulge outward, and they may occur at any level from the esophagus to the colon, and are most common after age 40. The presence of these is diverticulosis. When they become inflamed or infected, it's known as diverticulitis. So there's that itis again, the inflammation. Ulcerative colitis is limited to the colon and rectum. It appears in a continuous pattern in the lining, and the exact cause is unknown. There's a genetic link for some, often aggravated by stress, environment, dietary factors, and an irregular immune response. And diet and lifestyle adjustments might help. Surgery can eliminate ulcerative colitis by removing the entire colon and rectum, and this will result in a permanent ileostomy for that individual. Okay, next slide. And here is a polyp on the right. And my joke for this slide is I'm going to give you just a moment to digest this slide. So this polyp, just of interest, is at this size, has about a 10% chance of becoming cancerous. This is what they look for when they're doing your screening colonoscopies. Okay. So we've gone from top to bottom, and I hope this has helped you to broaden your understanding of how some of the issues of each of the organs can affect overall function. Now that we've talked about them, you have a chance to take another look at the general positioning in this slide of the body organs. And on the right-hand side, I've listed some of the related trainings that we've done in the past that I mentioned along the way. And these are all pre-recorded on the website. If something piqued your interest and you'd like to hear more about it, feel free to look those up. Are there any additional questions at this time?
So, Laura, I don't see any questions coming in, but that was very informative. You know, amazing how much information was packed into such a short amount of time. But obviously, these are things that we're seeing on a pretty regular basis, particularly the diabetes. I do strongly recommend that particular training. If you haven't already watched that, you probably should, because, you know, a very, very high percentage of the folks that we serve have diabetes, and understanding the difference, let's say, between type 1 and type 2 diabetes, the impact of having to inject insulin. Those are all things that directly impact a person's ability to transition to the community. So I highly recommend that one. They're all great, but that one's particularly.
Yeah, with the fact that I get to look over the medical records of the participants when I'm trying to offer suggestions to the transition specialists, I do see that there's, you know, those certain ones that just keep coming up, and, you know, diabetes is a big one. The chronic renal insufficiency is a big one. So the kidney disease one on the website is also a very good one, because it talks about the dietary restrictions people need to be on, and especially if they're on dialysis. And then, of course, COPD being, you know, the biggest killer in the world right now, people having respiratory issues.
Yes. So I don't see any other questions, but thank you, Laura. Like I said, that was a great training. We're going to end the webinar now.
Okay, thank you.